Welcome to the Infidelity Doctor channel. My name is Dr. Talal Al-Salim, and this is the Ask Dr. Talal segment, your place to ask me anything you want to know about affair recovery and affair prevention. Please remember that this segment is not a substitute for the counseling that you're supposed to be getting. This is merely a place for you to get some basic questions answered and a place for you to learn about my clinical insights when it comes to affair recovery and affair prevention. Before we get to the question of the week, please make sure that you like the video and subscribe to the channel so that you can get the most recent updates. The question of the week is as follows. I was a victim of sexual abuse. Can this explain my infidelity? So one of the videos in the channel actually addressed the different causes of infidelity, and this is a good opportunity to do a recap on the etiological factors that lead to infidelity. So there are three main categories of etiological factors and causes infidelity. The most common one is relationship factors, and this has to do with relationship deficits that people experience with their partner. We also have environmental factors, and this has to do with some of the socioeconomical factors and unfaithful immediate environments that can increase or decrease the likelihood for them to engage in infidelity behavior. A common example of environmental factors is usually the occupational environment of the unfaithful and to what extent that environment is conducive for healthy and appropriate boundaries with co-workers, clients, and colleagues. But the third category of causes of infidelity is the individual factors, and in this category we are talking about individual mental health issues that the unfaithful struggle with, as well as traumas that they have experienced in their family of origin and past relationships. So individual factors are the issues that the unfaithful brought to the table in their new relationship and has nothing to do with the betrayed partner and their satisfaction with them. But I always tell folks that regardless of the reason why the infidelity happened, even in the case of individual factors, the unfaithful is 100% responsible for the act of infidelity, meaning they're not off the hook, because we all have responsibility to make sure that we are healthy and well, and if we have individual issues, then it is our responsibility to make sure that those issues are being treated properly through therapy and or medication, to make sure that those individual issues are not impacting our life in a negative way or the life of our significant others. So sexual abuse fall into this category of individual factors that lead to infidelity. How does sexual abuse lead to infidelity? Research shows that when people are exposed to sexual trauma, regardless of what age, if this trauma is not treated appropriately, it could impact the psychosexual development of that individual. It could impact their sexual identity and the type of sexual behaviors they engage in adulthood. Exposure to sexual abuse as children actually have been linked with exposure to premature sexual knowledge as well as risky sexual behavior. And think of it this way, and I'll share just some examples of the clients that I worked with. I'll do examples with males as well as females. I work with a lot of female unfaithful clients in which they end up engaging in sexual infidelity, not because there is a sexual deficit in their relationship with the betrayed partner. It's that they have learned a long time ago that the only value they bring to this world is by their sexuality. So the only way for them to feel good or have self-worth is by getting sexual attention. So that's one concrete example of the byproduct of untreated sexual trauma. Another example with males, and this is especially the males who have been sexually abused by other males. Oftentimes they struggle with sexual identity and orientation, and if they haven't dealt with this trauma in a therapeutic setting, they might be trying to explore their sexuality later on in adulthood because they are uncertain about who they are and what's the proper identity that is more authentic to themselves. And oftentimes that I see a lot of those males engage in bisexual as well as homosexual interactions because they're trying to figure out who they are as a result of this trauma that have impacted their sexual identity. Now, whether or not which one is their true orientation, it just really depends on what was their natural trajectory and to what extent this trauma have got in the way of that trajectory. So hopefully that answers the question of the week. Feel free to leave your comments in the comment section below about the answer that you heard today, as well as suggestions of questions that you'd like to see me tackle in future videos. Until then, be well, be safe, and embrace the possibility for a brighter future. Take care.